What's going on? What's going on? Welcome to the Urban Health Nurse Educator. I am Steve Belcher. This show is the third episode of the Urban Health Nurse Educator. Today or tonight, however you want to call it, this morning's topic, self-management and kidney care. The important factor. Now, we know that a lot of people have kidney disease and kidney failure. And when you get hit with that, you have to know how to self-manage this disease. Now, let me read you something from the World Health Organization. The World Health Organization defines adherence as the extent to which a person's behavior in taking medications, following a diet, and or executing lifestyle changes corresponds with agreed upon recommendations from a healthcare provider. So how adherent are you? If you're on dialysis, transplant warrior, stage 1, 2, 3, 4, kidney disease, even 5, diabetes or hypertension, how adherent are you? Do you follow your renal diet or your doctor's orders? Do you take your medications as prescribed? Do you go to every treatment and stay on for the full time? People with kidney disease can live long and well. Let me repeat that. People with kidney disease can live long and well. Your day-to-day decisions have a big impact on your health. Because of this, you must be an active and informed participant in the healthcare process. You see your healthcare team approximately 12 hours each week. If you go to dialysis 3 days a week, 4 hours of treatment, that's 12 hours each week. And if it's 3 hours, then it's 9 hours each week. In total, that is just half of a day. The rest of the time, right? The rest of the time, you are on your own. You on your own. The process of dialysis can only do so much to improve your health. On a day-to-day basis, you are in charge of your own health. No one else. You are in charge of your own health. Not me, not your wife, not your husband, not your brother, your sister, not your friend, not your dialysis buddy, not your doctor, not your dietitian or your charge nurse or social worker, but you are in charge of your own health. The decisions you make have a huge impact on your outcomes and your quality of life. There are 4 important lessons you need to learn as a person living with chronic renal disease? One, your illness is serious. There are still patients out there who believe they have the not so serious kind of kidney disease. If you don't believe it is serious, you will never make changes to improve your health. This can lead to more serious health problems. Two, your condition is already self-managed. Every decision you make throughout the day, from what you eat to whether you walk or ride the bus, has an influence on your health. You are the most important individual in managing your illness. Number three, you have options. There is rarely one perfect way to treat a condition. In the case of kidney failure, for example, patients can be treated through different types of dialysis. Each type requires a different degree of involvement from the patient and length of time and frequency on the machine. Transplantation is also a treatment option. You need to understand the different treatment options available and look at the personal cost and benefits of each. Only you can decide if the benefits are greater than the cost. Only you. Number four, you can change your behavior. Yes, you can. Rarely do patients leave the doctor's office and immediately enact whatever change was recommended. The reality is that it is often has to be enacted in a series of steps. You have to take steps to do this. You can't change all in one time. It has to come in small increments. Significant behavioral changes can be made by setting small goals, taking that first step, and figuring out what you learn about yourself along the way. Some tips. Know all you can about your disease. Education is perhaps as important to your health as getting your prescription filled. Adult learning is often self-directed. What we learn best is usually what interests or motivate us most. What do you want to know? What do you want to change or see differently? What are your healthcare priorities? What are your healthcare concerns? Two, use your healthcare team as experts for information, tools, and resources, including treatment options and consequences for not following recommendations. Then consider how these fit with your preference for your desired state of health and outcomes. Three, you should feel comfortable negotiating with your healthcare team about your plan of care. Each patient is the expert in his or her own life. Absolutely. Federal regulation required dialysis facilities to invite patients to participate in their care plan meetings. You should not sign off on these papers. I'm serious. Don't sign off on these papers without having been involved in the decision process. Ask your healthcare team when they will be scheduling your planned care session, or ask to schedule one in the next month. Number 4, dare to self-care. Anyone can do dialysis with proper training, even you. No one will take better care of you than you. Unless you enjoy the time you spend in the dialysis center and the people you spend it with, consider doing home dialysis. Seriously. People have better outcomes with home dialysis. And we talked about that. If that is not an option for you, take more control of the care you get in center. Clean your own access site. Learn to take your own temperature, your weight, and your blood pressure. Hold your own site. Learn to access your site. Learn to pour your own needles out and apply your own bandages. You can also learn to place your own needles, SelfCannulation. Yes, you can do that. A lot of people stick themselves. Your center should be willing to help you participate in your own care. If they are not, you should ask why. Some resources you can reach out to: American Association of Kidney Patients. Guys, thank you for watching this episode of the Urban Health Nurse Educator, Episode 3, Self-Management and Kidney Care, the important factor. God bless you and have a good evening. Well, good morning.